HomeoCare, the chain of world-class homeopathy clinics with world-class care. HomeoCare is the advanced homeopathy clinic in India.
Congratulations, you are having a baby. Motherhood is a blessing. If you are delivering your baby for the first time, then your feelings are more special. There will be a lot of joy and enthusiasm everywhere. But there will be slight nervousness too. So, I, Dr. Hetal Shah, Senior Doctor at HomeoCare, would like to throw some light on the concerns experienced during pregnancy, how to deal with them, and will also be sharing some pro tips that will be very helpful to you. Watch the video till the end. So, some of the basic concerns are: first, morning sickness. A feeling of vomiting and nausea is morning sickness. Why does morning sickness occur? Whenever there is imbalance of dietary potassium and magnesium, lower levels of vitamin B6 are the known causes of nausea. Now, how will you relieve nausea? Avoid skipping meals, taking smaller meals more oftenly, avoid consuming water while having food. You can have it before or after food. Avoid having salty, spicy, fatty food, and also you can consume soda or ginger peppermint tea. So people will say morning sickness is normal, you don't need to go to a doctor, but you need to know whenever you have to visit a doctor. If you have severe discomfort, if your urine turns dark in color, if there is blood in your vomit, if there is a lot of weakness and weight loss, you have to visit a doctor. Next is backache. So during pregnancy, ligaments of your body naturally become softer and stretches to prepare yourself for the delivery. So because of this stretch, it might put pressure on your back muscles, causing backache. So how will you avoid this? So avoid lifting heavy weights. And if you want to pick up something from the floor, you need to bend your knees and keep your back straight. If you are going shopping and you want to carry those bags, so try to balance weight between both those shopping bags. Maintain a good posture while sitting. Avoid sitting and standing for long durations. And also you can practice some exercise for relieving the backache. Next is indigestion. So during pregnancy, in the early phase, indigestion is common due to hormonal issues. But in the second trimester, indigestions become more severe because your baby is pushing up against your stomach, causing bloating, eructations, heartburn. So it's a good idea to note down the things which is causing you indigestion and try to avoid them for future. Next is swelling during pregnancy. Most women often get swollen legs and ankles during pregnancy. So why does that cause? As your baby grows, your uterus presses on slightly, blocking your vein, which helps blood returning from the legs to your heart. And due to hormonal changes, your walls of the vein become softer, making it more difficult for the circulation and causing swelling. So how will you avoid swelling? Try to put elevated legs while sleeping. Decrease your salt intake. While sleeping, you need to sleep on your left hand side so that your blood returns to the heart easily. Avoid standing for longer duration and wear comfortable shoes. Next is anemia. So most common cause of anemia is iron deficiency and folic acid deficiency. Anemia can increase risk of preterm delivery and post-maternal infections. So what are the signs of anemia? If you have a pale skin, pale lips, pale nails, if there is severe discomfort while breathing, if you feel severe weakness, then you are anemic. If you want to know more about anemia, please find the link in the description box. Next is gestational diabetes. Women who don't have diabetes before pregnancy but develop diabetes during pregnancy is called as gestational diabetes. Hormonal changes during pregnancy can either not secrete enough insulin or not let it use normally, and the glucose builds up in your blood, causing high blood sugar. So managing your gestational diabetes by following a treatment plan by a healthcare provider will be the best way to manage it. Next is pre-eclampsia, that is pregnancy-induced hypertension. Is a very serious condition in pregnancy because there is increase of hypertension and increase in protein in urine. During this pregnancy, the placenta does not receive enough blood supply, which is the source of nutrients and oxygen for the fetus. So there are changes in your hair, there are mood swings, there are skin changes, there are anxiety, depression, and many other things which a woman goes through during pregnancy. So now the question is, are there any medicines which help pregnant women? If yes, are those medicines safe to be consumed while you are pregnant? Yes, homeopathic medicines are extremely gentle and safe for pregnant moms, and I will wholeheartedly advise you to choose homeopathy as a first line of defense, because homeopathy is mild, gentle, and not only safe but the safest mode of treatment for pregnant women. Why are homeopathic medicines safe? Because homeopathic medicines are based on entire constitution of a person. A person is studied in detail at mental levels, at physical levels, because our goal is to achieve a complete goal of treatment, and homeopathy does not have any side effects. So as promised, I will be sharing a few tips. So how will you prep yourself for the D-Day? So eat food for easy delivery. You should not be constipated before your delivery. Eat food that will help cleansing the bowel, like prunes, dates, almonds. Take a spoon of ghee and add it to the milk, which is going to enhance your clearing capacity. Next is your bag should be ready. Before going, your bag should be ready. It should have sanitary pads, cloths, napkin, a dress to breastfeed, a soft pillow to sit on during breastfeeding. Carry music, because at the end, what a child needs is a happy environment. So, mother's health during pregnancy affect the babies, and what all the babies go through will be shared in my next video. So please stay tuned for it. Thank you.